There are moments when time seems to slip through our fingers. A familiar face feels unfamiliar. A routine suddenly confuses. These are more than memory lapses. They could be signs of something deeper. This is the story of dementia, a condition that touches not only the mind, but every corner of life. Dementia is a general term for a decline in mental ability, severe enough to interfere with daily life. It's caused by damage to brain cells, which disrupts communication between them. This breakdown affects memory, thinking, language, judgment, and behavior. But dementia is not a single disease. It's a syndrome with many forms. Before dementia is obvious, there's the pre-dementia phase. Changes are subtle. Slight difficulty concentrating, occasional forgetfulness, or trouble multitasking. These early changes may go unnoticed for years. In the early stage, memory lapses become clearer. People may lose track of time, forget recent events, or have trouble finding the right words. Some may withdraw socially to hide these changes. The middle stage brings more severe symptoms. People may get lost in familiar places, struggle to recognize loved ones, or act out with frustration or fear. Sleep problems, delusions, and personality changes often emerge. In the late stage, independence fades completely. Communication may reduce to a few words or none. The person may need help with every aspect of daily life. Though memory fades, feelings like comfort, touch, and presence still resonate. Dementia comes in many forms, each shaped by how and where the brain is damaged. Alzheimer's disease, characterized by plaques and tangles in the brain leading to memory loss, confusion, and later complete dependence. Vascular dementia often follows strokes or chronic reduced blood flow. It causes problems with thinking, focus, and planning more than memory initially. Dementia with Lewy bodies. Marked by abnormal protein deposits in the brain, it causes hallucinations, tremors, and fluctuating attention and alertness. Frontotemporal dementia affects the front and sides of the brain, altering behavior, personality, and language, often appearing at a younger age than other types. Several factors increase dementia risk. Non-modifiable risks include age, genetics, and family history. Modifiable risks include smoking, poor heart health, physical inactivity, head injuries, and social isolation. Diagnosing dementia isn't about one test. It involves memory assessments, neurological exams, imaging like MRI or CT scans, and reviewing medical history. Diagnosis helps identify the type and rule out other causes. There is no cure, but treatment can help manage symptoms and improve quality of life. Medications used include Donepezil, Rivastigmine, and galantamine. Cholinesterase inhibitors that help with memory and cognition in Alzheimer's. Memantine regulates glutamate to improve thinking and daily function. Antidepressants, antipsychotics, or sleep aids may be used cautiously for mood and behavior symptoms. Non-drug therapies, such as cognitive stimulation, music therapy, exercise, and routine, play a vital role in maintaining dignity and comfort. Dementia may steal memories, but it cannot take away a person's value. Understanding it allows us to offer patience, love, and respect. Like, share, and subscribe for more health stories that matter.